Hello and welcome to Checking Our Pulse. I'm Marcus Hart. I'm the director of the liver transplant program at Swedish Medical Center, and I'm joined today by Etta Williams, who is an outreach specialist for the Swedish Medical Center, and Dr. Patricia Dawson, who is a breast surgeon and a leader in the Cancer Institute at Swedish Medical Center. And today, in this segment, we're going to check our pulse on breast cancer and how that disproportionately affects the African American community. And Pat, give us some background on this. You know, I was looking at some of the information, and that the incidence of breast cancer is lower in African American women. However, the mortality rate, the death rate from breast cancer for African American women is higher.
That's exactly right. African American women less commonly get breast cancer, but more commonly die from breast cancer. It's also a fact that African American women more commonly are diagnosed with breast cancer under the age of 40. And we don't really know why these things happen. We know that some of it has to do with access to care. Some of it has to do with misconceptions about going in for care, going in for screening. And there may be some biological reasons as well that are poorly understood.
Yes. And so, Eddie, you're involved with trying to improve access to specifically breast care or cancer care for women, African American women. Can you tell us a little bit about your role in that?
Well, it all started with me volunteering at Swedish in 1995. Yes. Actually, I was a patient in Swedish in 1994, and I wanted to give back to the community, so I started volunteering at the breast center. And then the job was posted there, and then I got the job, specialist. Mm-hmm. And from that, I got lots of good training, on-the-job training, yes, and information. And then I started going out and talking to women.
Yes. What are some of the challenges to get women to come in to access care?
Well, some of them, first of all, lack of knowledge that they need to go in. Yes. The next thing is fear. And then some is insured and uninsured, and there's just lots of things keep them from going in. Transportation, babysitters, mm-hmm, and
real practical issues.
Yeah.
Yes. And Dr. Dawson, this as a result results in African American women presenting at a later stage in breast cancer?
It is more common to see African American women diagnosed at a later stage with breast cancer. And again, a lot of that has to do with access, going in to get screening. A lot of women in the African American community believe that if you're not having any symptoms, why would you go in to get screened? Why would you look for trouble? Yes. And so they tend not to come in until they're really having symptoms.
Yes.
As Etta says, there's issues with women being underinsured or having no insurance, and they don't necessarily know that there are resources for them. And so Etta does a fabulous job of hooking women up to resources available in the community.
Mm-hmm. And so perhaps if we came in a little bit earlier, got better screening, absolutely, we might be able to close that gap with regards to the death rate that revolves around breast cancer.
Right. Despite the questions about how often women should get screened with mammograms that have been raised in the press, screening mammograms are our absolute best tool for early diagnosis of breast cancer.
Yes.
So we still encourage women, if they're over 40, to get a screening mammogram every year.
Yes. Now, does family history plays a role? It's one of those risk factors with breast cancer. Mm-hmm. Are there some other risk factors that would lead you to screen earlier, to screen more often?
Well, the biggest risk factor for breast cancer is being female, right? So all women over the age of 40 need to be screened. What we do currently is if somebody has a first-degree relative, a mother or a sister, who has had breast cancer at an early age, we ask them to start screening earlier. So we'll ask them to start screening 10 years before their mother was diagnosed. So if their mother was diagnosed at 40, we want to start seeing them for screening at 30. They may not necessarily get a mammogram every year at 30, but we want to get them in for screening.
Very good. So it's do self-exams, it's screening, and if Etta gives you a call, to respond and come in and get checked up. Is that correct? So this would wrap up our segment on breast cancer. And Etta, thank you for joining us. Dr. Dawson, thank you for joining us.
Thank you.
This is Checking Our Pulse. And this episode will replay throughout the year until June 2011.